Hello everyone, I'm Dr. Chandan here. Today I'm going to share you the most important topics in Obs and Gynae which you must know. Obs and Gynae is very important and very scoring subject, so you can easily memorize and remember these topics very well. Guys, I went through the last 11 papers of FMGE and I have selected the topics which are repeated in multiple exam and which might be expected to be asked in upcoming exam as well. So please make sure you revise these topics very well before you appear for your FMG exam. So let's see this topic. We have ectopic pregnancy, which is extremely important. We should know the clinical feature as well as the site where the ectopic pregnancy will occur and the time of rupture in that particular site. Along with that, by looking the parameter, you should know whether to manage the patient surgically or medically. Next is abruptio placenta. Again, almost in all the exam we can able to see the question from this particular topic, that is abruptio placentae. You should never miss this. Next we have placenta previa image. We should know the low-lying placenta, how it looks, and marginal placenta. By looking at the image, you need to identify what type of placenta previa is this. Next we have hypertension in pregnancy. It's like eclampsia, pre-eclamptic condition you should know. Okay, and treatment management is very important in hypertension. Along with that, when you start like magnesium sulfate in eclampsia, you should know what are the indication to stop that magnesium sulfate is also very important. You should learn. Next we have gestational diabetes mellitus and overt diabetes mellitus screening. You should know the cutoff value of like fasting blood sugar, and 2 hours after that what is the cutoff value, and HbA1c. You should know this very well. And next is abortions. In abortions we have different presentation like complete, incomplete, inevitable, threatened abortions. You should know all the presentation of abortions, and you should know the causes. Like first, what are the causes in first trimester abortions? You should know that. And we have types of pelvics. We have different types of pelvic like gynecoid pelvics, anthropoid, android. You should be able to know the identify the image as well. And we have MTP. MTP is again important, especially the treatment part. For example, until the first trimester, what are the drugs will give, and after first trimester, what are the drugs will give. Next we have PPH, that's primary, secondary PPH. We should know, and prevention of PPH is very important, as well as management also we should know. Next we have inversion of uterus, again important. Partial mole, complete mole, and the management. Next we have monozygotic twins like dichorionic, diamniotic, monochorionic, diamniotic, monochorionic, monoamniotic. You should be able to know this very well, and you should also learn about ultrasound to identify this one. Now we have placenta accreta, increta, percreta, and what are the treatment for this particular case. And the stages of labor, like we have latent phase and active phase. You should know in primigravida and both in multigravida. You should know that. And types of deceleration like early deceleration, late deceleration, variable deceleration, you should know. Then we have emergency contraception, like we have certain emergency contraception, levonorgestrel, COCP, IUCD, ulipristal. Here you need to know what are the doses, mechanism of action, as well as the effective till how many days you should know for some. Next we have vasectomy, is again important. Then IUCD, for example, postpartum IUCD insertion is done within how many. You should know IUCD is extremely important, you should never miss. Now breech delivery, and we have types of abnormal placenta we have, and its attachment also important. And cardinal moment of labor we have, and pelvic inlet is again important. And carcinoma of the cervix treatment part is very important in cervical carcinoma. And sex cord tumors we have some certain, so we should know. And clinical features of PCOS, and the treatment of PCOS is again important. Next we have uterus prolapse, especially the management in the uterus prolapse is very important. Okay, based on different age, reproductive age, and in geriatric age, how we have to manage that we should know. Now we have pelvic inflammatory disease, where you should know about bacterial vaginosis. We have trichomoniasis, candidiasis. You should know very well. This is also very extremely important. We can expect a question definitely from this PID. Then we have semen analysis and its parameters like the morphology, motility, concentration is again extremely important. You should know this very well. Next we have amenorrhea. What are the causes of primary amenorrhea causes? Secondary amenorrhea causes is also very important. You should never miss this. Next we have endometriosis. In endometriosis you need to diagnose the case, and the symptoms of endometriosis is very important, as well as know about the treatment. Now we have septate uterus, where by looking at the ultrasound image you should identify whether what type of uterus is septate or what type of uterate, and treatment of septate uterus is also very important. Maybe resection will be there. Now next is androgen insensitivity syndrome as well as testicular feminization syndrome. Know about this also. Then know about male and female internal genital formation also. Then again, one important topic is imperforated hymen. This is also very important. Know about that. Maybe they can give the image also. Maybe they can also give the case scenario also, where you should able to identify imperforated hymen. Guys, solving these topics is 50% of the work is done. Rest 50% of the work will be completed only if you solve the previous year questions, because in previous year questions there will be a image, many instrumental images will be there, many procedures they will show. We have to identify that. So that will be only done in when you solve the questions, previous year questions. So guys, you should never skip practicing questions, especially the previous year questions, on the daily basis, because you will learn many information. There is also many important information which are related to exam. So keep practicing the questions, and you can easily boost your score. Thank you.